Hi, I'm Christy from Tandem, and I'm here to show you how to insert, use, and disconnect your VariSoft Infusion set. While VariSoft can be used on any body type, you may find this set can provide added benefits if you have challenges with hand strength or movement. It can also help if you want flexibility with the angle of insertion. For example, VariSoft gives you between a 20 to 45 degree insertion angle depending on your body type. Before you get started, make sure you have all of your supplies ready. You'll need your pump with a filled cartridge already installed. You'll also need your VariSoft Infusion set and any additional supplies. First, wash your hands and clean your insertion site. Let it air dry. The VariSoft Infusion set can be worn on different areas of your body. Choose a site free of hairs, scars, stretch marks, loose skin, and tattoos. These are not recommended areas as the infusion set may not adhere properly and may result in poor insulin absorption. Check your infusion set and ensure the tamper-proof seal and sterile paper are intact. Don't use if they're damaged. Carefully take out the infusion set from the packaging. Hold the set with one hand and gently peel off the front half of the adhesive paper. Avoid touching the introducer needle. Carefully remove the needle guard by twisting and pulling. Pinch at least an inch of skin and tissue, creating a fold at the insertion site. Insert the needle at a 20 to 45 degree angle, then release the pinch. This ensures placement in the fat tissue, not the muscle. Press down on the adhesive tape to secure the front piece. Place a finger on the clear window to stabilize the infusion set, but try not to press too hard and make it harder to pull out the needle. Use the other hand to squeeze the ridges and pull the needle straight back. If that's difficult, straddle the clear window with two fingers while pulling. Now, place a finger on the front of the clear window to secure the cannula. Carefully lift the back of the infusion set and remove the back adhesive paper. Smooth the adhesive tape onto the skin. Next, take the tubing out of the packaging. Uncoil and remove the circular protective cap by squeezing the ridges and pulling. Attach the tubing to the cartridge connector and twist clockwise until it's tight. A small space is normal. Now you're ready to fill the tubing with insulin. First, hold the pump with the cartridge connector or pigtail pointing up to push out the air bubbles. Then check for air gaps in the tubing. If you see air gaps, continue filling until they are no longer visible. Finally, ensure you see drops of insulin at the end of the connector needle before proceeding. You're ready to connect your filled tubing to your infusion set. The tubing will only connect one way, so if you're having trouble clicking it in, flip it over and try again. The cannula, which sits under your skin, now contains air and must be filled with insulin. Use your pump or app to fill your cannula. Consider setting a reminder to change your site every 2 to 3 days. Don't forget to resume insulin delivery to complete the process. Keep a close eye on your glucose during the 2 hours after insertion. If your glucose is unexpectedly high, your site may not be absorbing insulin properly. When in doubt, change it out. Persistently elevated glucose is a sign that you are not getting enough insulin and therefore increases your risk for diabetic ketoacidosis, or DKA. Now that you've learned how to insert your VariSoft infusion set, let's talk about how easy it is to temporarily disconnect. To disconnect, place a finger to hold the infusion set stable. Gently squeeze the ridges on the area closest to the tubing while pulling straight out. Remember, never disconnect from the cartridge connector as this can introduce air into the tubing. Reconnecting is a snap. Simply insert the connector needle into the infusion set. You should hear a click. That's it. You're now ready to use your VariSoft infusion set. For more helpful resources, visit the pump training section of our website. Thanks for watching.